Good afternoon, everyone. Welcome to the Singapore Business Group webinar. The topic today is COVID-19, the road back to normal life. My name is Chung. I'm the Vice President of the Singapore Business Group, and I'll be hosting today's webinar. This webinar is held in collaboration with Raffles Medical Group, and we're certainly delighted to have our friends and topic experts Dr. Ong and Dr. Lai joined us and speak to us this afternoon. And straight off the bat, I would point out that we use the term normal, not new normal. And I think the speakers will talk about that. The agenda, as you can see in the slides, is an 1 hour program. We do a quick introduction. After that, we will have the speakers introduce themselves, and then going on to the presentation proper, and then a bit of chance at the back for Q&A. If the discussion becomes interesting, I do believe the speakers are happy to extend, say, for another 10 minutes. Very briefly, the Singapore Business Group is a non-profit organization established back in 1992. And has evolved from a social club of what we call a makan club, the eating club, with a membership of about 30 individuals, has now grown to about more than 350 members and is still growing. Our vision is to be caring, cohesive, and a reputable premier business group. We certainly want to foster business relations with other business communities, whilst promoting social, cultural, recreational, educational, and charitable activities. Now I'm really delighted to ask the speakers to introduce themselves. I would just say that it's not often you get to consult two doctors at the same time, but we have that privilege today. But at the same time, sometimes you wonder whether you really wanted to consult two doctors at the same time. Okay, anyways, on that particular note, so may I ask Dr. Lai to do a quick introduction of himself? Thank you.
Thank you so much, Chung. Good afternoon, everybody. I'm Dr. Lai from Raffles Medical Clinic. I'm actually based in Hanoi, and I've been practicing medicine for the past 15 years. It ranges from internal medicine, family practice, and also some part of the CDC event back in 2009 when Malaysia was having the pandemic of H1N1. So those experiences were pretty helpful in guiding us how to navigate through this current COVID pandemic. So hopefully the sharing later that I'll share with everybody will be useful for everyone as well. Thank you.
Hi, good afternoon, everyone. My name is Kian Soon. I'm from Singapore, and I think this year it's the 6th year I've been in Vietnam, and enjoying myself in Vietnam. So, and I'm based actually in Ho Chi Minh City, in the Raffles Clinic in Ho Chi Minh City. So we have 3 clinics. The Hanoi one is headed by Dr. Lai. I cover the Ho Chi Minh City Clinic, and we have another one in Vũng Tàu.
Thank you. Okay, so Dr. Lai will be going first. So over to you, Dr. Lai.
Thank you very much again, Mr. Chung. Once again, thank you to SBG for hosting this event and also inviting us. Thank you to all participants for taking your afternoon off. Valuable time for you guys to join us for this webinar. The topic that we'll be discussing today is about COVID-19, and it is titled The Road Back to a Normal Life. Hopefully after the sharing today, we can somehow convince that it is pretty possible to go back to a more normal life. Some of the topic of interest will be touched on today. Myself, I'll be covering the first 2 topics, which is the COVID situation globally as well as in Vietnam. And later on, my colleague, Dr. Ong, will touch more specifically on COVID-related tests and COVID-related vaccines. Okay, so this is actually a global situation back in April. This is actually a bar chart. It is plotted as a timeline. If you look at the x-axis, that is actually the dates of the weekly cases. And the y-axis is actually the total number of cases per week. What we see is that the cases actually goes up and down. And what is the reason for that? The reason is whenever there's a new disease that enter a new country, when the country is not well prepared, most of us are not too well prepared, and it causes a spike in cases. And later on, what happens is that public health measures will come in to actually contain the infection. If they successfully contain it, the infection will come down. And once we are okay, once we get complacent, again, cases will come up again. And again, they press it down again, cases will come down. I want to bring the focus towards the right-hand corner. If you notice the box on the right side, back in February when the cases were a bit low, what happens is that from February onwards, the cases just shot all the way up. What actually happened around that time? The reason is because there was a new strain of the COVID virus that happened. Whenever there's a new strain, if it is more infectious than previously was, often it will lead to a big spike again. So this is one thing. The second thing is if you can see the line that goes along, the dance along it, the trend is that whenever the cases goes up, the line goes up. And what does the line represent? The line actually represents the total number of deaths, meaning to say that whenever cases goes up, the death rate also goes up. Whenever cases come down, the total cases number is also coming down. So you see, it goes in a up and down pattern. That's why it is always described as a wave. You have a 1 wave, 2 wave, 3 waves, something like that. So the key to remember here is that whenever cases comes up, death will go up. And the most important thing is we are trying all strategy to bring the cases down, because when the cases can come down, the death can also come down. So this is the message from this slide. Fast forward from April to June, there was just an 8-week period. And how did it happen? If you focus on the right side again, the box, what happens is that the cases kept coming down. How did the country manage to reduce the case? Remember the first slide we were saying, the key is to bring down the cases. If you can bring down the cases, the death will come down. So the question is, how did they do it? If you look at the color on the bar chart, there are actually 3 colors that are most important. The first color is at the top side, which is the orange color. That actually represents the American region, namely US and South America. And then in the middle, there's the purple section. That is actually the Southeast Asia region. And actually a lot of cases are coming from India. So that contributes a big bulk of it. The main reason is because the population is just so much bigger there. And then the last one is actually the light green region. That represents the European region. Okay, from around April, when the cases were at the peak, something was done, and that's why the cases start coming down. What actually happened? So in the Southeast Asia and Asia region, what happened was there was a lot of contact tracing being done. Because naturally, this is actually a virus war. If we need to tackle the virus, we need to start identifying them. If we can track them, identify them, and separate them from the normal population, that's where we can bring the cases down. So active case testing was done and active tracing was done. So that allows cases to come down. Apart from that, sometimes there's a bit of underreporting, but then again, it will just contribute a little bit. But what happened to the American region and the European region? The cases clearly came down. And these are the countries which usually have very good reporting system. What contributed the extra cases to come down is because they did a lot of vaccination back in the early this year. So once vaccination hit a certain percentage of the population, cases will start to drop because more people will be protected. Some will be partially protected, but a big population will be somehow protected. We move on to the next slide. This is actually a spot map of the world back in April. As you can see that the colors represents the intensity of infection, meaning to say the darker the color, the higher number of cases in that region. And then the lighter the color either signify less testing, underreporting, or well control. The focus I want to bring the attention to is actually the left top corner, the North American region, and in the middle, which is the European region. Back in April, if you remember the chart, all the cases were very, very high, and it shows in the spot map, it is very densely red color. And we move forward to the next slide. That will be somewhere in June. What actually happened? You notice immediately the color faded away within a matter of 8 weeks. Okay, so the American region, you notice that North America is very, very calm now compared to the South American region, and European region is also the same thing. It's all much, much well controlled. Is it underreporting? So we look at the situation on the ground. If you look at the TV, you watch the football games in the Europe, you watch the NBA games in the basketball tournaments, You notice that stadiums are packing up again. They are allowing to do so. If the government is not confident that the vaccine will do some help in protecting the population, if they put the crowd back in the stadium, it's going to cause a big cluster again. So situation on the ground kind of calms down that vaccine somehow has made its way to protect the population. And then contact tracing, a lot of testing, all those things when it combined, it did a lot of wonder to bring the cases down. So the 4 slides, the message were, when cases come up, it goes up, death will goes up. When cases come down, death rate will also come down. And the whole idea is to do whatever we can to bring cases down. And the strategy so far that has worked globally, as you can see from Europe and US, is they did a lot of testing to identify the enemy, contact trace, isolate them from the population, and then as much as they could, they just vaccinate as many as they can. So that couple in and managed to calm down the situation, North America and Europe. Now, what about Vietnam? Let's look at Vietnam. Okay, this is the print screen data collected from WHO. There are a lot of information there, but the main information I wanted to highlight is actually in the red box. On the left side, that actually is the daily cases for the country. You notice that it goes up and down again. Whenever there's an outbreak, there is a spike. And then on the left side, on the right side, that is actually the total number of deaths so far up until 17th of June. Okay, a quick reminder, if all of us could remember, in Vietnam, we actually went through 4 waves. The first wave happened somewhere around April. So every time there's a wave of outbreak, certain public health measures will come in to contain the infection. And then strategies will be implemented. And you will see that the strategy keep repeating itself. The first time the wave happened in Vietnam, it was actually it was when the virus first became pandemic. And there were a lot of outbreaks in Europe, and the cases were imported back to Vietnam. If we could remember, what did Vietnam do and what did most countries do? What we did is we closed the international travel border to prevent importing of cases. And then whatever cases there was in the community, CDC basically did a lot of testing to all the contacts of the case. And then once they can track up all the cases, isolate them, treat them, and then they can clear this virus from the population. In public health term, this is called mopping up the case from the community, basically cleaning up from the community. So the first wave lasted probably about 2-3 weeks, and it came down after that. So that was the first wave. And the second wave, what happened? That was actually the case in Da Nang. There was a big outbreak. It was big that time, but nothing compared to now. Back in August, if you remember, what actually happened is there were illegal entry by land. So again, what did the country did? They shut down the whole Da Nang. They tightened up the land border. Again, they did a lot of contact tracing, a lot of testing. And that within a matter of 1 week, 1 month to 2 months, they managed to clear the outbreak from the population. And if you remember, whenever there's an outbreak, it causes us a lot of uncertainty in our life. It causes a lot of disruption to life, schools, businesses, everything is a hassle. When it comes to the third wave, that actually happened somewhere in January this year. It happened in Hanoi. And this time, what was the lesson in this wave is that there was a new COVID strain, and it happened to somehow have a longer incubation period. So whenever the virus have a presumed longer incubation period, it will escape the quarantine strategy, which is 14 days. So again, that's how it leaked into the population. And what did the government do? Immediately, they extend the quarantine period to 21 days, a big inconvenience to most of us. And then they did a lot of testing again, just to identify all the cases in the community. Again, they try to mop it up from the community. Did it work? Yes, it did work, but just for a while. It worked up until April, and then you see what happened. Even with a prolonged quarantine period, somehow the virus still managed to leak out from the population. And when it leak out, if the virus reaches a small family, it will just be a cluster of 4, 5, 6 cases. But if a virus leak into a big community, and what happened in Hanoi side and the north of Vietnam side is it hit the industrial zone. And when you have factories, thousands of workers gathering to work every day, when the virus enters this community, it will cause a big cluster. And what the government did, this time it will be similar. They locked down the north of Vietnam. They did heavy testing. In fact, I think if I heard from most of my friends in the industrial area, they basically screen them every 3-4 days, COVID rapid test, just to identify all the cases they can and just to clear up from the population. And the moment they can get the vaccines, there were some donations that came in. Immediately, the vaccines were channeled to the north of Vietnam to vaccinate a lot of the industrial zone. So this was all the 4 waves of COVID that happened in the country. Every wave has its lesson, and it's just that every time, whenever it comes in, public health measure comes in, and it's not surprising. A lot of testing, a lot of tracing, and when vaccination is available, they start to vaccinate. And it seems that once they managed to control the cases in the north, the same story is happening in the south. Pretty similar in a way that it hit a very dense population area, Ho Chi Minh City, and it hit the industrial zone, Bình Dương area. So you notice that immediately all the vaccines that were donated in the country, that were bought by the government for anything, almost 80% were channeled to Ho Chi Minh City, to the south, just to control the outbreak. And if I'm not mistaken, most of the factories will be undergoing a lot of testing in the next 1 or 2 months. Okay, the last slide from myself is actually a spot map of the country. Okay, so the spot map of the country basically is the same thing. The more dense the color, the worse off is the outbreak. And the lighter green and the darker green basically just mention that there's no cases there, or there were no cases for the last 14 days. So the take-home message from this slide is that whenever a virus enters a community, very strict public health measures will come in. And very often these public health measures will contain the infection, but it causes a lot of problem to the community. And do we always need to choose, we want good control, but we sacrifice economy, or we sacrifice control just to protect economy? If we choose the second part, usually we will sacrifice both disease control and economy. So that doesn't work. So we got to take the lessons from what worked globally. A lot of testing was done, a lot of tracing was done, and whenever possible, vaccination for the public. And once you reach a good numbers of population being vaccinated, very often the control will be much better, and we can go back to pretty more normal life from what we remember. Just look at the stadiums of the football game, just look at the basketball stadiums. Hopefully Vietnam will be in this, Asia will be in this picture very soon. So that will be the end of my presentation. Thank you very much.
Thank you very much, Dr. Lai. You're teasing us with the images of packed stadiums, and I'm sure that we all love to get back there. I'm going to pose a question of when do you think that is, but maybe wait a bit to after Dr. Ong has also given this presentation. But if I can just comment very quickly, I think all of us here, are certainly very appreciative of how Vietnam government, especially in the early days and stages, sent out clear messaging, put in the measures, and people, believe it or not, are pretty compliant, and they follow social distancing, mask rules, hand washing rules. And I think that's been great. That's how government and people managed this situation. But however, when you fast forward to present day, and with the new variants coming in, I think there's some concern and commentary as to whether or not the government is doing the best that it can to bring in the vaccines. Well, I guess in context, it's good to see that once we find cases and the variants impacting those densely populated areas and sectors that you talked about, especially the economic growth engines like industrial zones, then I think really brings home the point that certainly I think the leadership here is not going to drag its feet around getting vaccines, and I'm sure that all kinds of efforts are being underway to bring in more. And I do understand that industrial zones, a number of places, yes, that's like the vaccines are being deployed. I just have maybe just one question at this point. Dr. Lai, you mentioned that you all were the government, the health authorities were looking at the third wave and the longer incubation period of the virus. Is that the same as the Delta variant that we all seem to read and talk about today? So from my understanding, the Delta variant is more transmissible. I think that's one of the takeaways that I have. But is it the same as that third wave one, which you say had a longer incubation period, or are they different variants?
Okay, so basically, every time the virus will mutate, but sometimes it's faster, sometimes it's not. And whenever a virus mutates, some countries which have rolled out their vaccinations, they didn't bother to study the virus any further. Vietnam started to notice that there is a possibility that the virus may have extended with a longer incubation period. And it seems to be happening in Hanoi because we have patients who are quarantined, home quarantined for 21 days. And right about the time where they're supposed to be released, they do a last COVID test, and it came back as a positive result at day 21. So could this be the Delta variant, or could it be the predecessor to the Delta variants? Only the government of Vietnam would know, because they would do the DNA typing of the COVID virus. Yeah, I suspect the Delta virus is also in the community. Yeah, probably if it's not this one, it was just the immediate predecessor.
Okay, thank you. Okay, so now we turn to Dr. Ong.
Okay, thank you, Mr. Chung. Thanks to Dr. Lai for covering the macro situation, both globally and in Vietnam. So the topic for me today would be actually to cover the micro situation of how we can protect ourselves and our families, our co-workers from this pandemic. Looking into the past, I started working as a doctor actually in the midst of another pandemic. It was the SARS pandemic in 2003. Having lived through those times, I would definitely say that SARS was a lot scarier than this current COVID-19. However, the economic impact is a totally different thing. For SARS, it lasted slightly more than 6 months. There was significant economic impact at the time, but not in the same level as what we are seeing currently. Now, I think since the pandemic was recognized, it's already more than 1.5 years. And we are still not over yet. I think as a result, there's a fair bit of pessimism, in the community and globally, because jobs are being lost. And now we are even thinking of, like, different from SARS, this COVID-19 will be with us for quite a long time. Let's talk about a new normal, implying that things will be different and not as good as in the past. But I think, we should take a step back and remember that while pandemics are quite rare, they are not at all unusual. So, and after every pandemic, through human ingenuity and our resilient economy, things will go back to normal, and it will, in fact, our economy and our general welfare and all that will actually improve. And so I think we should not be so pessimistic right now, and actually look forward to things becoming normal. And in fact, I feel that in a couple of years, definitely, the economic activity and levels of human advancement will definitely exceed 2019 before this pandemic started. Okay, how we are going to get there is the question for today. So for COVID-19, it's like any other viral illness, right, without an easy cure. So for this kind of illness, to overcome it, there's usually only two methods. One is actually to do extensive testing. We should test people as frequently as possible and as many times as possible. This is to actually pick out all the new clusters, and so that we can pick out all the new clusters early before it spreads. The second prong approach is actually to vaccinate. Unlike last year, now we have vaccines already. I do encourage people to get vaccinated as much as possible. Currently, vaccination is only for people above 18 years old. But I believe that in future, data will come, and we will eventually vaccinate everybody, including children, pregnant women, and people with severe disease and things like that. Example is something like influenza. influenza, we are giving vaccines to very young kids and people very old and people with chronic disease. So eventually, COVID vaccines will be like this. Okay, so number one, for testing, so which test do we use? Currently, the most well-known test is the PCR test. This is the gold standard test, the test that has the longest history since this pandemic and the one that's most accurate. The problem with this PCR test is that it takes quite long to process and it can be only done in a fairly well-equipped lab. So typically, the PCR test takes about anything from 24 to 48 hours. So this test falls short whenever doctors see the patients, or we need a much quicker test to quickly screen patients. So the rapid antigen test gives a result within about 20 to 30 minutes. It's not considered as accurate as the PCR test. It's actually still a very good one. So what happens is that because it's not as accurate, we still need to confirm with the PCR test. However, recent data shows that this rapid antigen test is quite good, and it's a very good screening test and a quick test to pick up cases, in the clinic setting especially. So in Raffles Clinic, we actually have both tests. For clinical use, we often do the rapid antigen test because it's very quick and it gives us the result within a reasonable period of time, about 20 minutes to half an hour. However, for other users, for example, for people who are traveling overseas, we would use the PCR test. So this is how we use these two tests. While I talk about these two tests, I want to mention a few pitfalls about tests in general. For both the PCR tests and the rapid tests, the important part of the test, actually the limiting factor, is the taking of the sample. Of course, this is quite intuitive. If you don't get a good sample, obviously you will not get a very good test result. So the thing is that to get a good sample is not so trivial. So, actually you need to do a nasal swab. And for our clinic, we take swabs from two sites. Once we get a throat swab, which, the pharyngeal swab, right? So we have to take a sample from the back of the throat. And the other sample that we take is the nasal pharyngeal swab. Actually, for this nasal pharyngeal swab, you actually need to stick the sample fairly deep into the nasal pharynx. So this is where it might be a little bit uncomfortable. So that's why I think, even for the antigen rapid test, we do not recommend self-administration. I understand that in Singapore, antigen rapid test has been rolled out to many pharmacies and all that for people to test at home. So I think the Singapore authorities are well aware of the limitations. However, I think, in view of the public health imperative, so this decision has been made. But I think in Vietnam, we still recommend patients to do all COVID tests, actually rapid or PCR tests, in a setting like a clinic with trained personnel to take the samples. The other thing I want to touch on is actually rapid tests, but for antibodies. These are rapid tests which sometimes can be bought online, which purports to give a COVID test result from a finger prick test. From a finger prick blood test result. I would advise people not to use this kind of test. The reason is because antibody tests are actually, they do have a fair bit of variation because antibodies, there are many different kinds of antibodies. For example, like acute infection, we have IgM. Longer term immunity is IgG. And also for COVID, there are different kinds of antibodies to different parts of the virus. For example, the spike protein and the nucleic acid proteins. So this antibody test, as a result, comes up with quite a bit of variation. Currently, it's only recommended, in a very specialized research setting for very trained lab personnel to interpret such tests. So I would, advise everyone to please avoid antibody rapid tests and don't use this kind of test. It will create a lot of uncertainty and false positive and false negatives, and basically not very good test to use. Okay, this is, I think, the topic that everybody has been waiting for is vaccination. Okay, yeah. So for vaccination, I think the take-home point I want to advise everyone is actually to take whatever vaccination that's available. All right, regardless of what brand of vaccine or what technology the vaccine is used, all vaccines are very safe. In the beginning, we don't have much data, but now I can say with much certainty and information, because now data has come with for most or nearly all of the vaccine brands that are now currently available, and all vaccines are very safe. All right. Certainly, the benefits outweigh the risk. So, regardless of what vaccine you are offered, please take the vaccine as which you are offered. This is very important because currently the vaccination programs of every country is still run by the various governments. Only in very, very selected cases are vaccines are being approved and given out to private individuals and private clinics. So I believe in many parts of the world, vaccination is not, you can choose whether to take vaccine or not to take vaccine, but you don't have a choice on which vaccine to take. So I think this is my take-home point, to make sure that everybody go for vaccine. Once you are offered the vaccine, please go take it. There are a few other things about vaccination that I want to cover. One is the do's and don'ts of vaccination. Like I said, vaccines are very safe, so most people taking the vaccine would have no problems. But then vaccines are still a kind of medication, so minor side effects unavoidable. I think for most of the time, what we advise is that all medications, this is not only for COVID vaccines, make sure you sleep well the night before, make sure you drink plenty of water. And after the vaccine, the most common side effect is actually the injection site pain. So this goes away in a couple of days, and mostly not a big issue for the vast majority of patients. A very, very small number of patients often get a bit of body aches, and even fewer patients might have a very short spike of fever, maybe on the night or the following day they take the vaccine. This is usually harmless, and it goes away fairly quickly within 24 hours. If patients have fever or more than 24 hours, or have other effects, side effects, or any other things that may or may not be attributed to the vaccine, of course, consultation with a doctor would be prudent. There are also a couple of controversies or things that my patients have asked me about the vaccines. Mainly, they will ask me two things. One, which vaccine to choose, based on the efficacy. And the other one is which one has less side effects. I think it's always natural to compare and contrast between the vaccines. But I think at this point, because all the vaccines have the clinical trials done, right, in various countries and at various times, and also the clinical trial design of all the different brands of vaccine are very different. So I think the results of efficacy is actually not considered comparable from each other. For example, we know that the mRNA vaccine have very, very good efficacy. I think the reported efficacy is above 90%. But subsequent vaccines that came after mRNA vaccines have somewhat lower efficacy. Right? The reasons for this, I believe, has actually less to do with how effective the vaccine is, but when and where the clinical trials were done. The mRNA vaccines were mainly done early on in the pandemic, whereby actually the variants of concern were not so common. That means things like the B16172 variant, the B1351 variant, all these were not so common when they were doing the clinical trials for the mRNA vaccines, like Pfizer and Moderna. As a result, it is unsurprising that you have extremely good efficacy. However, the other vaccines that came after mRNA vaccines, right, the clinical trials were mainly done in places and countries and at times where the variants of concern were actually becoming the dominant strain in those countries. So as a result, again, it will not be surprising that these vaccines that came after have less reported efficacy. So I think these vaccines that came after were less effective. It's just that the clinical trials were done differently and at different times. The other thing is the side effects. I think the take-home point is that all the vaccines are very safe and the side effects are actually minimal. However, we know from past experience with other vaccines that most of the side effects are actually based on techniques of doing the vaccine. So for the vaccines which are newer in terms of technology, I believe that the companies will eventually improve the techniques and all that so that the side effects will be less. This implies actually also that the vaccines that are used most, that are made using more traditional technology may have comparatively, less side effects. But otherwise, I think all the vaccines are fairly safe. So I think if you are given a chance, an opportunity to take the vaccine, please take these vaccines. Currently for Vietnam, the vaccines are still under the control of the government. So the Vietnamese government is actually prioritizing and rationing all these vaccines to the higher risk individuals before they give to the general population. Although I'm aware that gradually and they are going to open up to private imports. So anybody know, or any of the listeners, you all work in the logistics industries, or you are able to help get vaccines to the country, as our clinic, Raffles Medical Clinic, will be very happy to work with all of you. We have 3 clinics and we are licensed to vaccinate. So if you have any source of vaccines, we'll be very happy to help you administering these vaccines.
Okay, so thank you very much, Dr. Ong. So with that, I wrap up today's webinar. Thank you, Dr. Ong and Dr. Lai again in Raffles Medical Group. Thank you to my secretariat for organizing this. Thank you, the participants, for joining us. So with that, I wish you a safe and good afternoon. Thank you, everyone. Bye.